From Ausmed Education, hello and welcome to the second episode of the Care to Learn podcast series. I'm Wayne Woff, and each month we sit down with interesting and influential professionals working within healthcare and education. For this episode, we'll be talking to Tony King, an educator at the Intensive Care Unit at the Epworth Hospital in Melbourne. Tony is an experienced educator who's passionate about empowering people through education. He strongly believes that with knowledge comes confidence, choice, and job satisfaction. In today's episode, we'll speak about the educator's role as a mentor, coach, and role model, and the importance of collaborating with the broader education department. Tony will also provide some tips on engaging the reluctant learner, striking a balance between teaching hard and soft skills, and giving effective feedback. So let's get into it. Great to have you with us here today, Tony, at our Care to Learn podcast. We'll kick off by getting you to tell our audience just a little bit about your professional background and your journey to your position now as an ICU educator.
Yeah, thanks, Wayne. I started my journey at the Austin Hospital over a decade ago now, and I've been very fortunate to always have really great role models in the education space. The educators at the Austin ICU have been in their role for 20 years, almost all three of them are around that ilk, and they've just provided fantastic mentors. And pretty early on, I was quite interested in doing education as a role. And over my years in ICU, I've completed a number of stints in different roles and always found myself drawn to the education side of things. And then eventually the opportunity opened up at the Epworth Richmond ICU, and I jumped for it, and here I am now.
So you've been in that role now for how long?
Touch over a year, and before that at the Austin I'd filled in for the educators there when they had leave and things like that, and I'd undergraduate teaching, lecturing at universities, a few bits and pieces here, there and everywhere.
Well, it'll be very interesting to hear your response to the next one from the context of your time at the Austin and now as the educator at the ICU in Epworth. From that perspective and from your current perspective, what do you think a great education and training program looks like?
Yeah, again, so I've been very fortunate in my workplaces that I've experienced two workplaces that have a very good culture. I think when you talk about an education program working and what makes it work, it really speaks to the culture of the workplace. It never falls down to one or two people. I think it's a culture that is engaged in learning, that it values education and the educators within that are really facilitating the education. They don't have to hold all of the knowledge, but they should be there to facilitate learning and development. And that's certainly the experience that I've had. One of my colleagues has just retired from the Epworth, and she's been in an education capacity for 25 years. So it's been very, I've come into the Epworth and reaped the benefit of what she's laid the groundwork for. So I think an education program that is working is one that people are engaged in, they're interested in, and they really value education throughout the whole workplace.
And in terms of just taking that a little bit further, obviously, with any workplace, with education particularly, you'll come across challenges, you'll come across blocks, you'll come across difficulties. Maybe speak to us a little bit about what you consider some of those challenges are, and maybe just your responses to those challenges where there are difficulties, where there are blocks. Maybe it's personnel, maybe it's system related. Just your insights there, I'm sure, would be of interest to our audience.
I think the biggest barrier to education or block that I've ever experienced in all of my years is dedicated education time. I think there is absolute value in bedside teaching and in the clinical context, but if you're looking to aspire to the deeper thinking and more critical thinking, you really need to get people out of the clinical environment, where they're in a headspace where they can really take in and think about what they're being exposed to and what they're hearing, free of distraction. You really can't analyse and synthesise information if you're listening to alarms, particularly in ICU. There's a lot of distraction, and really you have to get people out of that environment. And that's the biggest barrier that I've ever experienced in both workplaces, is getting people freed up in paid time away so they can develop themselves.
And taking that just a little bit further in terms of making your assessment of group needs versus individual needs of learners, is that something that occupies your mind in terms of the whole group and then trying to look at your colleagues as individual learners and what that might mean in terms of plans for them and their learning journey?
Yeah, absolutely. I think it's quite easy to identify the group learning needs of a department. You look at what your core business is, you look at the things you do often and make sure that people are skilled in that. Identifying individual learning needs is a lot harder because it takes time, it takes investment. You need to speak to people, you need to look at what might be coming up in the future for your department, and then seeing if your workplace is equipped with the skills that they need to provide safe and effective care. So it does take time and a bit of thought. So being an educator, I'm very mindful that I don't want to just be busy all the time. I need to allow some time to think, appraise what I'm doing, evaluate what we've been doing, and then ensure that what I'm doing is what the workplace needs.
So it would be fair to characterise that in a role such as yours, that the relationship issue with your colleagues, the people that you're seeking to facilitate education with and for, is most important. So your personal relationships with them plays a critical role?
Yeah, I don't think when you talk about relationships, you have to be friends with people, but I think you need to invest in getting to know your staff. I think that's the only way that you can ever meet their needs or hope to meet their needs. And certainly when it comes to, I think we'll talk a little bit about reluctant learners in a little while, but that's certainly something that you just need to invest the time.
And I'm interested today to explore how you would strike the balance in terms of that educational space between what I would call important clinical skills, technical skills, particularly from an ICU point of view, and the other skills that are hugely important, no doubt, within that environment, whether it be communication, whether it be debriefing, whether it be negotiation, dealing with stressed families, grieving families potentially. Can you just speak to us a little bit about how you would make decisions around that balance and what are some of the factors in that decision-making process?
I think you've identified probably the hardest thing for any educator there. Identifying the so-called hard skills are quite easy because, again, you review what you're doing, what you think the skill needs are of your staff, but really you can train anybody to do a skill or a task. What you're really trying to appeal to are the core elements of what makes a nurse a nurse. So I don't like the term, but soft skills is thrown around from time to time, but I think it de-emphasises the importance, particularly in nursing, of those skills. So things like empathy, compassion and listening are skills that are crucial to nursing. You hope that people are well equipped with them if they come into our profession, but it's not always the case. To develop those skills, it really comes down to mentoring and coaching. And again, it's about investing the time. It's becoming more and more of a pertinent issue in intensive care as ICUs, modern ICUs now, are increasingly isolated as a clinician. You have often a one-to-one ratio. The nurses are often inside the bed space where you can't really see your colleagues around you and they can't see you. So that sort of natural peer-to-peer supervision where you see somebody's interaction with a patient or family and you see, gee, they handled that really well. You just don't get that as often anymore because people are in their own bed space. So they're not seeing the interactions of their senior colleagues around them and thinking, gee, that worked well, that didn't work so well. And then having your own interactions and being able to come out of the bed space, turn to your colleagues and ask for some feedback. Say, how do you think that went? Those interactions are becoming fewer and far between. So now the role of the educator is even more critical, that every interaction that we go into the bed space with, I make a very conscious effort to engage with the patients or consumers or whatever term you want to use, and just trying to model that behaviour of, this is how effective communication should look, linking everything we're doing back to the patient, ensuring it's what they would like to do. So I think more than ever, the role of the educator in role modelling and coaching is really important.
Yeah, I think that's a point that, and maybe you could compare and contrast whether you've seen that rising in importance since you started as a nurse and the pivotal importance, because it's my view that used to be very prevalent, and I have a nursing background that goes back some 30 years. Then I think we lost it for a large chunk of time, but now there's a re-recognition of the need for that very personal, as you've termed it, the coaching, the mentoring, the modelling. Would you just like to discuss that a little bit further, what you've seen over your journey maybe in terms of people that have helped you in that way?
I think nursing is coming full circle in that regard. I think probably for the last 10 or 15 years there's been a real emphasis on critical thinking, recognising deteriorating patients, a lot of hard clinical tasks and assessment skills. And I think potentially nursing lost its way a little bit there, overemphasising the importance of detecting changes in vital signs and maybe losing a little bit of what it means to be a nurse, which is that compassion and being there for your patient and trying to advocate for a more holistic picture. And I think the national standards to a degree have helped putting the patient at the centre again, and I think nursing is starting to rally around that again, emphasising the importance of the role of the nurse in this very busy acute context. I work in intensive care. It is a very acute environment, and re-emphasising again that it's all about the patient, their loved ones, and what it means for them, and ensuring that our care is in keeping with what they would like.
Yeah. And in terms of another issue that I would think is very much on the radar, particularly in an area such as ICU, and relates back to the educational landscape, the supportive landscape, is the issue of burnout for staff. From an educator's point of view, I suppose, A, I would imagine it's very much on your radar, and B, both your personal and organisational responses to that space.
Yeah, burnout is a very big issue, and educators have a very unique, contribution to an organisation in this space, in that we don't often sit under the umbrella of the managers of each department. Educators usually are in an education department, so you're in a unique position where you don't really answer to the unit manager of that department. So it's something you don't really appreciate until you're in the role of an educator, just how much counselling and support and professional coaching you do to your staff group. I really underestimated just how much of a professional resource you are to your staff as an educator, and how powerful that role is in inspiring people about your profession again, reigniting that passion as to why they became a nurse in the first place. I think it can be somewhat punitive at times with the national standards and accreditation and all of the quality markers that we're scored against these days. I think it's very easy for a nurse to get a bit down on themselves and just think, oh, here we go again, it's more of the quality stuff. So I think that role of a counsellor and a mentor is really, really important for an educator. But the other side of that is that I firmly believe that education is power, that if you can provide people with education and they feel well educated, more confident in their role, that they're less likely to be burnt out in their role, that they feel more comfortable and confident about what they're doing, and it provides them with choice. If you're well educated and you do find yourself, spinning down that rabbit hole of maybe I'm feeling a bit burnt out, if you are empowered with education, it opens up choice to you, so you can try something different. And
I think that's a really helpful insight, and it's maybe a way of looking at it that people, I think, at times don't see in terms of being well educated, well supported, very confident in what you're doing, that there are options, that if that situation and scenario does unfold, that there is the option to move on, to look for other challenges. Yeah, I think people sometimes feel somewhat trapped. Yeah. They don't have options available, and education provides those options and outlets. I'd just pivot back to a word that you used earlier, and it will certainly resonate with the nurse educators out in our audience listening, and that's, we'll just leave a little pause, the reluctant learner. Just your thoughts and your insights, your tips, your commentary about people that you meet that have that resistance, reluctance to learning, and how you would seek to work with them.
The first thing to do is just take a moment to reflect and think, am I creating barriers, or is the workplace creating barriers that's making it difficult for this person to engage? Now, often that's not the case, but it's still a very important step, I think, to take as your first step. Then if you think, no, I think it might be the learner themselves that are reluctant, well, there's something that is motivating this person to come to work every day. Unless there isn't, then that's another issue, that's a performance management issue. But if it's just that they're reluctant to engage in learning and education, then you've got to think about what the motivation is for this person to come to work and trying to engage with them. And again, you have to invest some time, if you have one or two reluctant learners, to feel out what is their motivation for coming to work and how can you leverage off that so that they feel engaged. And look, workplaces are huge things and you can't ever expect 100% of your workforce to be fully engaged at all times. So maybe you have to accept that you've got a small cohort of people that are at this point in time a bit disengaged. That's fine, but you just can't forget about them. I think you just have to have a think about why they might be feeling that way at the moment.
Yeah, and I think that's very true. I think from a professional point of view, that sense of persistence with staff can at times, what doesn't look like a great space a month in, 3 months in, 6 months in, can turn round. And you would have had examples of that. People who've been previously quite reluctant and have improved over time with that persistence.
Absolutely. I think we sometimes forget that we're all human and we have lives outside of work. And it's completely reasonable that people go through periods where they're more disengaged or more engaged with their workplace. Provided that they're still delivering safe and effective care, I think that's absolutely fine and it's to be expected somewhat. But just ensuring that you don't forget about those people, that just keeping an eye on them and keep providing those opportunities for them to re-engage with the workforce and re-engage with the education department.
And maybe just before we get to our closing questions, just within your workplace and how you interact with the rest of the education team. You mentioned before that commonly in healthcare organisation, the structure is that the education department is potentially separate from the unit sort of structure and the org chart. Your interaction with the broader education team and what that provides to you, opportunities, observations, collegiality, sharing of information, just a little commentary in that space.
I think as an intensive care educator, you can provide a lot of clinical support to your fellow educators. You're in a unique position in intensive care that you're seeing the deteriorating patient regularly. So those, skills of assessment and what comes next for these patients is our bread and butter. We see it every day. So you can provide that context and support to your educators from the clinical, the hard skills we sort of touched on before. But the skills of an educator don't really change no matter where you're working. So there is still a lot for us to learn as ICU educators from our education team across the whole hospital. And getting out there and having those discussions, is a problem shared, is a problem halved, things like that, and just bouncing ideas. We recently had a workshop only a couple of weeks ago as an education department, and I think a lot of people in the room when they were sharing their experiences realised just how much synergy there are with our frustrations and workshopping ideas. So absolutely, we can each support each other in our workplaces.
Terrific. We'll close off today's Care to Learn podcast with just some short final questions. The first one of those, what's one thing you've learnt in the past month that's really stuck with you?
At the workshop only a couple of weeks ago, we were talking about feedback, and I use a particular technique called SBI, Situation Behaviour Impact. And we just went through a couple of other alternative models, and I just highlighted for me again the importance of planning feedback, that it's not something you just do off the cuff. Particularly if you're dealing with a reluctant learner or somebody who's underperforming, you have to plan those conversations and think about what's the motivation for this particular person at this particular time that you're talking through things with. So planning is key, I think.
The second one of the questions, what's your favourite personal learning tip?
Using every available resource. I think it's unrealistic to think in this day and age that you're going to have all of the information you need at the tip of your tongue at every interaction, especially when there's something like the internet or YouTube and journals and textbooks. Everything is at your fingertips now. I don't think people should be afraid to search far and wide. I know when I'm grappling with a difficult concept, I'll read about that in about 4 or 5 different platforms, and then finally the penny will drop and you can go back to your seminal text and read the detail, but you've got to have that aha moment before those difficult topics sort of fall into place. And I always just advocate to people, read 3 or 4 different blogs, texts, whatever it takes for it to fall into place. And certainly YouTube is an amazing resource these days. There's barely anything that's not on YouTube. Even procedures. We were doing some training last year with staff around cardiac surgical advanced life support. And we said there's fantastic YouTube clips that if it gets to after hours and you're struggling to remember some of the algorithm, pull it up on YouTube and share it with the team. There's no harm in doing anything like that.
And across your substantial educational journey, my final question, what's the best advice probably that you've received from a mentor, a colleague, a senior educator about this CPD continuous learning space, the best bit of advice you've ever been given and maybe that has obviously stuck with you?
I think the key thing that resonates with me is that you can empower yourself through education. I think education gives you choice. If you present yourself as knowledgeable, you're engaged with your workplace, people will seek you out to ask your opinion and ask your advice, which will only increase your job satisfaction. It will increase your influence in your workplace, and you're less likely to suffer things like burnout, and opportunities will end up coming your way. If you're engaged and knowledgeable, things will come your way.
Terrific. I think that's a perfect point to conclude our Care to Learn podcast today. We thank you, Tony, for your time.
Thanks, mate.